August 23 regular session.
Thank you. Are we online? All right. Let's call this regular meeting of the Marion County Board of Supervisors to order. Roll call. Mr. Grandia.
Keisha Johnner,
Here.
Mark Ramey,
Here.
Steve McCombs.
Here.
Is there a motion on this morning's agenda?
I make motion to approve today's agenda.
Second.
McCombs,
Aye.
Ramey,
Aye.
Johnner.
Aye.
Very good. Jake, any communication?
Just the one comment from the individual, Tom Wiley down in Melcher, Dallas, that has been forwarded to you and the county engineer.
Okay, very good. Thank you. Supervisors?
Yes, I do. I've had 2 emails from congregation at the St. Mary Catholic Church regarding 218th place. Spoke with Tyler and he has been in communication with them.
Right, very good. I think, yeah, we might have all got that one.
Yep.
Yeah. Let's see, the only other thing I had was a request for a meeting from a developer from Pella, Overland Property Group. I think I'm meeting with them at 1 o'clock today. Is that what I'm doing? Okay. So other than that, no other communications. Very good. It's the public comments portion of our meeting. The public can speak on items not listed on this morning's agenda. The board cannot act on those items, but they could be topics for future meetings. Are there any public comments on items not listed on this morning's agenda? Nothing online and nothing in-house. We will move on. Would entertain a motion on this morning's consent agenda.
Make motion to approve today's consent agenda.
Second.
Ramey,
Aye.
Johnner,
Aye.
McCombs.
Aye.
All right, very good. On to business. Got some appointments here for the Marion County Development Commission. Carla? take it
Good
away.
morning, supervisors. The Development Commission is consistent of 9 total commissioners representing various different areas of the county as well as areas of expertise. And currently, we have 3 vacancies that were at the end of June that we have found individuals willing to serve if appointed. That you have seen their applications, which were submitted to you. And their names are up on the screen. Doug Stewart is the CEO at the Pella Rural Electric Cooperative with Mr. Vollmer going off our commission. Doug will bring that utilities perspective as well as a rural perspective because that's primarily who they serve as clients to the commission. Tony is the superintendent of schools in Pleasantville and will help us with not only education, but also workforce development issues and a connection with education in addressing some of those issues. And Sarah Roberts from Knoxville here is involved with the chamber. She's a local business owner and also from real estate. So providing 3 really good perspectives to the commission as we look forward to our work.
Very good.
And they are 3-year terms. Each commissioner on our commission can serve up to 3 3-year terms or a total of 9 years before having to step off the commission for at least 1 year.
Okay, very good. Thank you, Carla. Supervisors, any questions on any of the proposed appointees?
No, I don't. I just have a question for you, Carla. Thank you for, reaching out. I'm assuming some of these people have applied and through you. In regards to, I know your board has to be, is it so many 50-50?
Right, gender
versus-
equity
yeah.
as well. And this would make us 4-5, which is as close as we can get to equity. Obviously with
can't do a
9, you
half.
can't do a half person. So
Right.
we're 4-5.
And then tell me again, the rest of the commissioners, where are they located at? Are they, is it spread throughout the county or, where those others are at? Are we heavily located like in the Knoxville area or the Pleasantville area or the Pella area? Where are the rest of those commissioners at?
Our chair is Rob Judkins. He serves as a Pella representative and works at Marion County State Bank. Megan Weiler Green is our chair-elect. She lives in Pella, but owns a fairly substantial business here in Knoxville. So we have a couple of them that are kind of, I would say, dual citizens where they have maybe live in one area, but have business interests in another area. And our secretary treasurer is Brian Thomas, who lives here in Knoxville and serves as a Knoxville representative. The other commissioners that are on the commission are Jason Bingham, who is from Pleasantville, who works at Pella Corporation, who brings, again, another corporate perspective to the commission and kind of a dual citizen. And Stephanie Bonstetter, who lives in Knoxville School District area, but does work for Central College. So again, a kind of a dual role. And how many does that leave me?
Yeah, that's 5. So you just have 1 left. Okay.
Okay, Barb Kniff McCullough, who was the last Pella representative. And we don't know with her upcoming election what that will mean.
Sure.
Okay.
Good. Isha, anything else?
No, just, as we have spoke before, Carla, there's been some expression in making sure that we have, we reach out to those other communities and make sure it's not all Pella, heavy. So, going forward, I appreciate you reaching out to Sarah. Appreciate you reaching out, or whether they applied. I don't know how they did that. Do they apply?
Just like any commission, the application to apply to serve on a commission is on the website.
Okay.
So anybody at any time can fill out that application. So that is out there. It is very open to folks to fill out that application. We only can appoint when we have vacancies, obviously. So this particular time we have 3, which is a lot. Usually we don't have that many at one time. We have a couple of our commissioners that are fairly new. Stephanie and Megan are just in, I think, their 2nd year maybe on the commission. So, but we also are trying to balance not only geographic, that's not our only consideration. We're also trying to look for the expertise that we need to drive economic development. So it's not just based on where somebody lives, but it's also based on what they know and what expertise. So we try to balance not having all bankers on the board or having all one kind of perspective and having various different perspectives on the commission.
Very good. Carla, thank you.
Carla, have you spoken with IT about getting the form changed on the website?
I have sent an email to them. I sent a ticket into them. I did talk, I think one of the things in talking with Brian, who is the web person that we deal with Neapolitan Labs, one of the things that you all need to probably make sure before we go to the step of updating that form on the website is that that's the form you want to use. So if you want to change any of the questions or slightly adjust that form, that review probably needs to happen before we build a form on the website, but that's certainly something that can be done, and I'd be happy to work with IT and Neapolitan Labs on that. I know we have several forms for our economic development and tourism sites. They work very well. People are able to print them, they're able to save them, they're able to do things with them that our current form, in the way it's put on there, people are not, it causes a lot of frustration for people trying to apply.
Okay, well, I think we need to make it easier.
I agree.
Yeah. And what'll happen then is, like, it could happen just like our Leadership Red Rock application, which is going on right now. People fill out the application, it comes right to my email. So it could come to all of your emails, plus whatever department head is ahead of that commission. Makes it very simple that way for us to have that as far as Leadership Red Rock goes. So I do have some experience in building those forms with Neapolitan Labs. And like I said, we've been very pleased with how that works efficiently.
I would be in favor of go ahead and move forward with that, just so simplify the process.
Okay, I'll circle back around with Andrew and see if we can get that, and certainly maybe ask that you look over the form to make sure that that's the questions you want to ask.
All right, very good. Is there a motion to approve these appointments for the Marion County Development Commission?
I'll make that motion to approve.
Second,
Johnner,
Aye.
McCombs,
aye.
Ramey,
Aye, very good. Thank you, Carla.
Thanks, Carla.
We have a discussion item. It's a courthouse ground special event application for Marion County Emergency Response Commission. Cal.
Yeah, so this is something we do every year. We're starting to get it back up and running again after the COVID stuff, so we're building it back up. This year we have, we'll be shutting down the streets in Knoxville around the square, and then having the cattlemen's coming in to do a meal with all the area first responders and public safety personnel available that night to do demonstrations, discussions, of the 9/11 memorial, just kind of combining the nights, the national night out and the 9/11 memorial into one event.
Okay, very good. We have done this in the past, right?
Yes,
Cal?
sir.
This is not a first time, and Chris has signed off. They just need power from the pavilion. Is that all you
That's-
really,
I believe
all you
that's
really need?
All we need is power in the pavilion.
And you guys are gonna have restrooms of some sort, or what are we doing there?
We've never had restrooms in the
Yeah, there's
past.
never been.
You haven't? Okay.
It's kind of more of a come and go as you please event. It's not
Yeah,
a lengthy event.
Okay.
So,
okay. Yeah, I don't have an issue with this. I think it's a great event, Cal. Thank
Thank
you
you.
for doing it. Is there a motion on the special event application?
I make a motion, we approve the application.
Second.
McCombs,
Aye.
Ramey,
Aye,
Johnner,
Aye.
very good. Thanks, Cal. Now we have a Class C wine license application for Nearwood Winery. Jake? you got
So,
all the
I don't
packet
know,
right here?
I don't know if Dr. Venata is online or not. So this is a standard, it's an ongoing, long-term application for this type of thing. And, so the only thing unique about this is, Alcoholic Beverages Division at the state level is actually still catching up from their, conversion to their new, programming.
Yeah.
And, COVID and various things. So, essentially, this renewal is for 2 years, which kind of is in arrear to last year and this year, just to keep the process going. They've done everything needed for us. We really don't get the applications until they've satisfied all the online application stuff for alcoholic beverages and have dram shop in place. So, asking for 2 years worth of effectively last year and the upcoming year for Nearwood Winery, I
Yeah.
guess.
Very good. Thank you, Jake. Appreciate it. Are there questions on this application?
I don't have any.
Nor I.
Is there a motion on this application?
Make motion to approve.
Second.
Jake?
Ramey,
Aye,
Johnner,
Aye.
McCombs.
Aye.
very good. Thank you. Now we have resolution 2022-66, which is the assignment of certain Marion County tax sale certificates. Michaela?
Yes. Okay, so we had kind of laid the groundwork at a former bo- have an echo at a former board meeting, when we amended and adopted ordinance 51, which would allow us to assign some of our county held tax certificates at the request of a municipality to that agency. As I kind of laid out at that time, this is, I feel, a good thing for Marion County because that takes the responsibility and the liability of rehabbing and somehow dispensing of those properties in a way that would get them back on the Marion County tax rolls. That takes that out of our hands and puts that in the hands of the cities, which is where I feel that belongs. So basically, this item and the next item involves using that ordinance to be to allow the Board of Supervisors to sign that county held tax certificate. In this case, this parcel will be assigned to the city of Melcher. And then it's up to them to follow the tax sale foreclosure procedures and acquire a tax sale deed on that property.
And we've talked to Melcher about it.
Yes, in fact, one process that we implemented was to have their city council sign off on this in a resolution.
Okay, good,
So that was part of the procedures that we put in place.
very good, very good, Michaela. Any questions, board?
I just have a question for you, Michaela, so that I make sure that I understand. So in regarding the outstanding taxes that are there, those will, I mean, obviously, we're signing this over to the city, then the
Correct.
city sells that, cleans that lot up, sells it to whatever, those funds will go back to them. We will not see any of that. Is that correct?
Correct. Part of Iowa code is that if you use chapter 446, typically you abate those taxes. But at this point, the back taxes on these parcels are considered uncollectible. And both of these have a large special assessment against them.
Okay.
Put on by each city. Obviously, based on the lower value of these properties compared to those special assessments, we're never going to
Right.
collect that.
So Michaela, does this count then as a write-off essentially for us?
Basically, yes.
Very good.
At least through this process, Michaela, they can get back on the tax rolls eventually.
Yes,
Yeah.
Okay,
and
so-
typically when I bring a tax sale assignment to you guys, we're requesting that that county held tax sale be assigned to some sort of private agency or individual. And there's no guarantee in that situation that that person will follow the tax sale foreclosure procedures and actually obtain a deed and do what we intend for them to do and clean up that property and get it back on the tax rolls. To me, when we're assigning that to a city, I feel like we have a pretty good feel for their intention and that they will follow through with those procedures.
Very good. Thank you, Michaela. Any other questions?
Nope.
All right, is there a motion on this resolution?
I move we approve resolution 2022-66.
I'll second.
Johnner,
Aye.
McCombs,
Aye.
Ramey.
Aye. Now we have resolution 2022-74, another tax sale assignment.
Correct. And this is basically the exact same situation, other than the one thing you might notice on this particular property is that the taxes are not as delinquent. There's
Right.
still a large special assessment. Actually, this is what I would encourage cities to do before they get to that point where they're 10, 15 years behind in taxes. And I have to present the delinquent tax list to the auditors, and we have these, really long delinquencies. To me, this is a better case scenario where they're willing to step forward and take over that property early on and get it back on the tax rolls.
Very good.
I was just wondering, how long can they be delinquent before that the city can, come to us and ask that?
Well, if under chapter 446, it meets the definition of an abandoned property, they can do that as soon as the taxes go delinquent. So, and this one has been delinquent 2 years, so it's on county held tax sale.
Very good.
Ideally, if it meets the definition under chapter 657, that's typically what we see the cities use to take over those properties. And that may not even have delinquent taxes. So that's kind of a first line of defense.
Okay.
This is for those properties that don't fall under that legal definition.
Very good. Thank you, Michaela. Is there a motion on this resolution?
Yeah, I make motion to approve resolution 2022-74.
Second.
McCombs,
Aye.
Ramey,
Aye.
Johnner.
Aye.
Thank you, Michaela.
Thank you.
Very good. We have a receive and
Mhm.
file for the Marion County Treasurer's Annual Report. Michaela,
Still here.
you're still here. What do we got?
So this is a conversation we have every 6 months. I'm required by Iowa code to bring to you the semi-annual report after December 31st and the annual report after June 30th. Again, this is a snapshot of everything that Jake and I do throughout the year. I take in the money, Jake writes the checks. So this is kind of a summary of revenue and expenses for the county. It's the same information that's presented to you on the monthly reports that you get from Jake, just in a semi-annual and an annual format.
Right.
Our auditors go through this with a fine tooth comb.
Jake, everything checks out from an auditor standpoint?
Yes, so far, absolutely. We're constantly being,
Has the frequency gone up?
that they come.
Yeah.
I don't know, the frequency hasn't necessarily gone up, but the level of digging has.
Okay. Okay.
I can attest to that.
What's, when you say, what does that mean? I mean, having done a lot of audits in my day, what are
Yeah.
you talking about?
First glance, how to say this, would be, we have been working, some of the offices have been there quite a while. So, when they make suggestions or when the auditors make suggestions or to improve process, you do that, or you do that to the best of your ability, and then you move forward. So maybe some of it is that we have worked hard to improve our practices or processes. So then they go looking somewhere else.
Okay.
Does that make sense?
I do feel that they request a larger sampling of transactions than they used to.
Okay, that's what I wanted.
There are
yeah.
also certain state requirements that we now have to meet that we didn't have to meet before. For example, on the motor vehicle side, they've come down with some different checks and balances that didn't used to be there. So, which is a good thing. That's not a bad thing. It's
Right.
just often more work for us.
Very good.
Yeah, they focus pretty heavily on the property tax side and those types of things.
Sure,
Take it all the way down to parcels and
They do.
that type of thing. So
sure. Okay, very good. Any questions on this board?
No.
It is a receive and file. Is there a motion to do that?
I make motion, we receive and file.
Second,
Ramey,
Aye,
Johnner,
Aye.
McComb.
aye.
very good.
Okay, thank
Michaela,
you.
Thank you.
Thank you, Michaela.
We have an update, Marion County Public Health. Kim Dorn, we've got a lot going on there over the last several months. So Kim's got a packet. I don't know, is this going to be up there? It will be?
Yeah.
Okay, good.
But let's not put the financial one because I sent the wrong one. But this one's correct. One is in front of you. Okay, so, yeah, there is a lot going on right now. And,
Kim, can I hold up for a second?
Mhm.
Is that the air conditioner? Is there a way to shut that down? Because I'm having trouble hearing.
Me
I don't know
too.
if anybody else is.
Yeah, I am too.
So I've got
Move your mic over a little bit.
water on the brain half the time.
is that
anyway.
better?
It's a little bit.
That's a lot better. Okay, I could use my outdoor voice. My kid yelling voice.
It's just my age, Kim. All that
Well,
loud.
if it's
mu-
your
all that-
age,
all that-
then
all
I'm
that-
really in trouble.
All that loud music as a kid.
Yeah. Okay. What's on the board right now is the table of organization for the merge between Iowa Department of Public Health and DHS, which they called alignment. And what it's turning out to look a little bit more like is merging IDPH into DHS. And this sets the stage for a lot of the things that I'm going to talk about, the changes that are happening locally. So this is the new table of organization, and you'll see that there's one with the yellow arrow, and that is public health. And in that line, there are some that are highlighted yellow, and if it has an L beside it, that means that it's a local thing. If it's got an S by it, that means it's a state thing. So the state carries out the majority of the work in that area. So you'll see that there's not much there for local public health, to be blunt. The health promotion and chronic disease prevention, screening and interventions, tobacco use prevention and control, those are both local issues to be dealt with locally. And that little green thing there, that means that there's grant money that goes with that. So everything that's yellow that doesn't have green is a local thing that is funded locally or not done to be.
So can I stop you,
Mhm.
Kim, just real quick? I just want to make sure that we understand the chart. So based on the reorganization, this is the current list of state services and local services.
Correct,
Okay, so,
correct.
so things
That are-
that the big change, one of the big changes is that many of those S's, am I making the correct assumption, were some of those were L's? Or
No,
were they funded by the
They
state,
were-
but they were,
they've always been kind of state
okay,
things. I've got a document that has all of the mandatory things that boards of health are responsible
Okay.
for, and it's like 17 pages long. But it has a few things that are the Board of Health must, and a whole lot of the Board of Health may.
okay.
And so this is their table of organization, and I just kind of went through and, okay, this is what we're involved with, and this is what the state takes care of. So I
Okay.
just kind of,
All right. Very
Okay.
good. Thank you.
yep. And so you'll see that under that public health column, there's not a whole lot of service type things. So you don't see WIC or maternal child health or oral health or first five under that public health column. It's under the community access column, which is next door to it. And clear down at the bottom, you'll see wellness and preventive health. So family health, reproductive health, child and adolescent health, oral health, nutrition, and physical activity, and WIC. That is currently in our wheelhouse. However, that's changing. So we'll talk about that a little bit more. So I just kind of wanted to give you the layout that things are changing up here and it's affecting things down here. So right now, IDPH and DHS are coming together. It was announced last week that the Department of Aging is coming into this structure next year. And Early Childhood Iowa was already moved from the Department of Management under DHS's supervision this year. So state departments are getting put together, which is not necessarily a bad thing, but how it flows down just kind of depends on what they do up there, makes a difference on how things are put together down here.
Mhm.
Okay, so next page. The other thing that's happening currently is this is a competitive year. And our WIC and maternal and child health are competitive programs. And maternal child health has always included maternal health, child and adolescent health, oral health, first five, and Medicaid. And previous to this year, we used to compete every 5 years, but it was competing per county. And this year they gave a prescribed group of counties and it's all or nothing. So it looks very, very different. So the next page is a map, I believe. Yes. So that purple area, number 8, is our current service area. And we built that service area. It looks a little crazy, but there was method to it. Jasper, Poweshiek, and Marion is the ECI area. And then
ECI.
Early Childhood Iowa.
Just want to make sure the acronym.
Oh, sorry.
People who
Yeah.
aren't familiar with it.
Yeah. Yep, sorry about that. So the Early Childhood Iowa area that Marion is a part of is Jasper, Poweshiek, and Marion. And then we kind of built it around the cross region because we wanted our service area to kind of mirror what what cross region was. And then Appanoose is not part of cross region, but in the early 2000s, Appanoose was being served by American Home Finding, and I don't remember why, but they were told they weren't going to serve them anymore, and they came to us and asked us to do Appanoose, and so we did. So we just never let them go. We just kept serving them. So this is the current map. So the next page is the first revision of what they're calling collaborative service areas. And so they kind of kept things a little bit together. They separated our early childhood area. Madison and Warren were a maternal and child health project, a small one, so they just kind of lumped that in with this one. But they didn't keep that one. They moved on to another collaborative service area map. So the next page is, this one's the final one. And this one is not good for Marion County. So they basically took Marion County and glued it onto that southern part, that green 15 is the southern part of the Cedar Rapids DHS area with Marion glued on. I don't see a lot of other commonalities with that group. And when I asked, hey, how did Marion get stuck on there? I got a pretty vague answer. But this is where it landed. And so this is how the applications have to be written. And so we wrote them. And our main competitor, our only competitor, is American Home Finding out of Wapello County. So
So Kim, I want to make sure we kind of link all this together for everybody. With this final service area and this being a competitive bidding year,
yes,
we bid now within that territory.
right. And we bid
So
for the,
understand that's the, when we go through those iterations, we get to this territory, that's the territory now we're doing the competitive bidding for.
right, for the entire 15.
And
And it's-
most of these counties, we've never,
We have not served
Service.
most of them. And American Home Finding in Wapello County has served most of them
so
for quite a long time.
any guesses on where this story goes? Keep going.
So the next page is the application schedule. And I know that people go, applicate, why do I care about that? Well, there's some rhythm to it. The first one that came out, okay, it used to be that when you applied for child health, it was the umbrella for child health, adolescent health, maternal health, first 5, and family planning. So all of those things were kind of put together, except family planning, they kind of took apart and set it over here because most of the family plannings are in FQH, are in FQHCs, are in organizations like River Hills and Ottumwa. So what they did was they broke them all apart, and we had to apply for each one individually and separately. And so the first one was first 5. And so of course we applied, they applied, and the award dates are kind of important because you don't know what, we didn't know what the award was while we were writing the next grant. And those grants all kind of work together, and there are requirements of working together, and there are requirements of if you are the provider for WIC, you have to let child health and maternal health be in your clinics. So there's all that kind of, all those ties together, but you didn't know as you were writing, you had to make a lot of assumptions. So yeah, so it was the process was messy. It was messy.
Well, I mean, let's think about it from previous application processes.
Yeah.
Very different.
Extremely different.
So when you break apart these different programs like that, you're basically making financial assumptions on things you don't even know you're going to get into the future. So you could get first 5, but you may not get WIC.
correct.
Or you could not get first five, but might get WIC, but you wouldn't know because of the application deadline. Am I understanding that correctly?
That's correct.
Correct.
And so, and they kind of try to tie everything to those WIC clinics. So that WIC one was kind of an important deal because the WIC agency calls the shots on where's clinic going to be? When is clinic going to be? How much space is there in clinic? And is there enough space to allow the child health and the oral health people in? And that has been a consistent problem with the previous way it was done, when WIC and maternal and child health and oral health weren't all in the same shop. Then, you know, we would go to Appanoose County where a different provider had WIC and we had child health, oral health and all that. And they would say, we don't have room in clinic for you. So it's, I think this is an attempt to kind of fix some of those problems, but I don't think that they actually fixed everything.
Kim, can I ask a question? When was the final map? When was that? What was that date? Do we know when they said, hey, this is the final and this is it?
The final map, it was.
'Cause I know it
don't know
said
that.
this
I
other
could,
one
I could
was-
look it up,
With
but
11/6/20. I just didn't know how long, they took to do the process. That's what I was
Oh.
wondering.
the process has been a long one, but I can look that up, but it was shortly before the release of the first application. And so it was so the first application was released January 19th, so it was the early January.
January of 22, right?
Yeah. Yep. Okay. So the next first five, which is healthy mental development, that is the program that Stacy Haas operates for us. And it works with physicians to link families to needed services to help assure healthy mental development in those first 5 years, because we know that what happens in that first 5 years sets the tone for the rest of their lives. And that, so when a physician has a concern with that a family is struggling with some issues that they believe will impact the mental development of that child, then they get a hold of Stacy. Stacy does a lot of talking with them and care coordinating, and then she links them into services to help improve those mental development issues for that child. So it might be maybe a child is lead poisoned and then we would help find the source of the lead poisoning and take care of that, help the family to get out of that environment where that lead poisoning occurred, that kind of thing. It might be nutritional. Maybe they don't have enough money for food, so she would refer them to food banks and things like that. So there's just a lot of care coordination that goes on. So that was the first application out, and it was awarded to American Home Findings, and I got notification that our contract would be ending on June 30th instead of the federal fiscal year. So we appealed, and there were a lot of appeals clear across the state. And then the entire RFP was rescinded statewide. So the state just pulled the whole thing back in and act like it never happened. And then I received a contract amendment to a contract that they'd already discontinued, but I don't know how they do that, but okay. But we got an amendment to continue providing services through December 31st. And they told us that we should expect a new application to be posted. We haven't heard when, but we expect that this new service area will be implemented in January. So they need to get on getting that thing posted, but they haven't told us when.
So it is going to American Home Findings though?
That was the original, award. But now that they rescinded the RFP, everything acts like it never happened.
And you're not be able to get any answers
Do we have to make
state
another
level.
application?
But we'll have to do another application. Yeah, so we'll do another application for first five when
Oh, yeah.
they post it.
Yeah, that was your last bullet point. I'm sorry.
Yeah, no, that's okay. That's all right. Yeah, this thing is just messy beyond words. They never really gave us a formal reason for why they rescinded it, but grapevine talk was that and when you go back and look at it, you can see it. What they scored it by was not the same rules that they gave us to write by. So that's why they rescinded the whole thing.
Yeah, I'm trying to get all this straight. in
I
my
know,
head.
Maybe this is more detail than you want, I don't know.
If this would have went through as initially
Yeah.
granted,
Correct. American Home Findings
would
would
our
have it.
citizens here in the county, would they have had to go to Wapello County to receive services that we had currently provided?
It depends on how American Home Findings set those services up. In all of these changes, WIC included, because they were awarded WIC, and we are not going to be doing WIC. They will do WIC. And so it will be set up the way they set it up,
Okay.
and we won't have any influence in how those services are delivered.
Hmm.
It's a big loss. It is. So, okay, so that's the story for first five. So that is a wait and see. We are still providing those services. We will provide those services through the end of December, and we will see what the application looks like when it comes out, and we'll give it a shot. Okay, next page is WIC. October 1st, the contract goes to American Home Finding in Ottumwa. And American Home Finding will notify the clients of the location and times of services. Their application did say that they would double the number of clinics in Marion County, and that makes for 8 clinics per month in Knoxville and 2 per month in Pella. They submitted, their application did not have any locations for services, but they have secured locations now. Their Knoxville clinic is going to be at Raceway Mall, unit 1050, 813 Lincoln Street. I just got that email this last week. I did offer them to talk to us about continuing to hold WIC clinic in our building, and they declined.
Really?
So, yeah. They set it up after they're awarded. They set it up the way they think it should be set up.
How many clinics did we have? Did we have it? I mean,
We
certainly.
had every Wednesday.
Okay.
So 4 a month in Knoxville and 1 a month in Pella. And there was still room in those on the schedule. There was still room on the schedule in our schedule.
So the people that receive these services, Kim, they've been coming to our building.
Right.
How are they gonna know where to go? I mean, do they?
They are, American Home Findings is to let everybody know where the clinic is. And we sent out letters to all of the WIC.
Current users? will
Yep.
they-
So we sent out letters to everybody, and then as people have been coming into clinic, we've been letting them know, because we didn't know where the clinic was going to be. We just said, you need to contact American Home Finding. Here's their phone number. And that's the way it works.
Well,
And-
They're holding these, I guess I'm confused. When a clinic at Raceway Mall, what does that mean? Do they,
I,
how do they?
that is their decision on where they
That's their deal.
choose to have WIC clinics.
See, there will be no more coordination with Marion County Public Health on WIC.
Correct.
That's the thing. I think people have to understand the way this program works, and probably many of the other ones will go through. We're not the ones through public health responsible for notification or that services are rendered.
No, I get that.
So
Mark.
we-
I'm just,
so-
it just does, it does.
But that's what I'm at. That's
It's
what,
just not
Right.
very logical. And I mean, how they're doing it.
well,
Their,
this is the state of Iowa, Steve.
Yeah, I know.
their application had no plan for how they were going to serve Marion County
Huh.
or Monroe, and they were still awarded. So I
The
don't know what to
thing-
tell you.
The thing,
they did- they
the
didn't
thing that we
have-
will have to do is ensure, I don't know who does this, but if they put, they're going to do 8 per month and 2 per month, and they're going to do these things, people will have to say, are you doing them? You said this in your app. Are you fulfilling those obligations that you said you would carry out in this application?
Is that how they were getting more of these grants? Is that they put in, they didn't, you were saying, you just said that they didn't list how they were going to, how often they were going to service
They,
Marion
they
County?
put on the schedule of clinics, they put clinics into the schedule for Knoxville and Pella. But where they were going to and how they were going to implement was not in there.
Okay.
So they had no places. They had not made any arrangements for places. They had it to be determined in the space area.
It just seems to me like you made the offer, our facility, that looks to me like they could cut their overhead down and serve more people if they would have done that.
Well, my email just offered to talk about keeping the service at our building, that we could have that conversation, and they declined.
Amazing.
So, yeah, so what will happen for Marion County clients is that when we get calls, we will refer them to American Home Finding to get their answers. So we'll not be able to assist with any formula problems, breastfeeding problems, food package, any of that stuff after the 1st of October. And this is, we did send in an appeal, but then, when your staff sees this, they start thinking, you know what, I gotta take care of my own family here. And so we have started losing staff. And, it's not great that we lost leadership staff in WIC before the appeal process, but I understand why I sure understand why they
Sure.
were
Right,
headed for safe territory.
I get it.
But I didn't feel like we would be able to bring up new leadership staff and be ready to implement by the 1st of October, region-wide. So I pulled the plug on the appeal. I just didn't think we could do it.
And honestly, I don't, I don't know if, on the appeal, if it would have made any difference. It just seems like they kind of had their mind set up. I mean,
I don't know.
in their
One
communication.
of the things that Kim and I checked on when we went through this process was this driven by the legislature?
This,
In other words, did they pass any kind of change or authorization for these folks to reorganize in this fashion?
so what we learned with that, and I focused my question on the reorganization of IDPH with DHS, because I think that's probably what's driving a lot of this. And we looked to find the legislative action, and there was on page, I want to say it was like page 63 or something like that, of the appropriations bill was the language to bring together IDPH and DHS. It was not a freestanding bill. It was not separately,
It was,
um,
buried in a funding bill.
yeah,
Does that sound familiar?
it was
Yeah.
not
Sure does.
discussed as its own bill.
No.
And when I brought that up to the state Board of Health and the state board that oversees DHS, Director Garcia said, well, we've been talking about this for a year. People should know.
Yeah.
And just kind of was like, well, she knew this was, I mean, she didn't say she knew this was coming, but she may as well have.
That, I'm going to
it's-
summarize this.
but
Kim, you
it's-
tell me if I'm wrong. Okay, we've been working on this for a long time. They buried the authorization in a funding bill.
Mhm.
They threw out their language, assuming that everybody should kind of know, but they did not have any statewide conversation as to whether this would be a good idea or not. As far as engagement went, it was very hit and miss as to how this reorg would work.
They would say, the state would say that they had a lot of discussion. And the lot of discussion was at the state level.
That's what I mean.
But there was very little input or consideration to what that does to local public health.
So, and that's exactly what I mean, Kim. The local folks were not involved. Our legislators certainly didn't tell us this was coming.
They didn't know because when I
Yeah.
talked with
Yeah.
ours in January, he went, what? And I said, yeah, this is a thing. And he's like, I've not seen anything of it. That was
Yeah.
Dustin.
Yeah.
And so, yeah, but it was in a funding bill, in the middle of a funding bill. And, if you don't pass the funding bill, there's all kinds of things that aren't funded. And so that kind of ties people's hands too. I mean, maybe they could have taken it out. I don't know. Maybe they didn't read it. I don't know, but that's where it was.
But here's, Steve, this goes to what you were, here's my perspective. You have an organization, Marion County Public Health, that has been administering these programs successfully for years.
Since the 90s.
And you are now going to shift these programs to an organization that in their application provided no specific detail as to how they were going to carry out any of these functions. But you gave them the award. You just said, we're going to do 8 locations. You didn't include much on financial information, or are you going to be able to make a profit doing this? And when I say
Well-
profit, are you going to be able to cover your expenses and not come back to the counties and ask for money like we do in the mental health side? Because what they're going to do, my assumption is they're going to do these clinics. And if the service numbers go up, and it doesn't matter what up is, because they put nothing in the application, sooner or later, they will come back to a board of supervisor meeting and say, we do more in Knoxville now. Could the county chip in some more money?
I would hope that the
yeah.
grant, I mean, that's what the language reads, that they can't do that, but,
That's the same process in mental health. And they do it every time, every year they come back and ask for more money.
Well, the WIC grant is a pretty financially thick. It's well-funded.
So it can cover a lot of
But-
cost.
Yeah, and their budget did have, we just did a straight 10% admin cost in it, and you can ask for up to 15%.
Yeah.
But we asked for 10, and they asked for none. They asked for
Wow.
0 admin,
That's
but
what I thought.
they just broke it down differently and put their administrative cost in as direct cost. So it looked like they didn't have any admin, but
Sure.
their director is not going to be in there doing direct service, and their HR is not going to be in there doing direct service and that. So they just broke it down differently.
yeah, so it
Yeah.
looks like, but if you're just looking at it, you know, scoring it and it says 0, then they're like, oh, well, look, they're gonna do it for 0, you know, and
Yeah.
is there another thing? Is this American Home Findings a nonprofit versus
They-
having a county doing it?
They are a nonprofit.
Makes them feel better, you
Yeah.
know, saying, oh, we're
Yeah,
giving
they're a
awarding it to a
nonprofit.
nonprofit. Yeah.
Jeff, do you have a comment?
Kim, have they rewritten or updated the rules, the admin code for all of this? They didn't do it legislatively. Then I would assume that they're going to use existing legislation and just change the rules to fit the mold of their vision.
Well, but remember, it was a competitive process before, but it wasn't outlined how that competitive process occurred in the rule, in the code, or in the administrative rules.
Fair enough.
All
Okay,
right, Kim, let's
Okay.
move on.
okay. Maternal health, that's going to be provided by American Home Findings. That will be scheduled and provided by them. They were awarded. We did not appeal that. And the reason we did not appeal that was because we didn't know the outcome of child health. And if we had appealed maternal health and gotten maternal health and then not gotten child health, we'd have been financially upside down before we start. So there was no point. And they already had WIC, so, and those two things go together. Okay. I didn't do child health. Oh, I guess that's on a different page. Sorry.
Yeah.
Child Health Award will be announced August 30th. It was supposed to be announced last Wednesday, but don't know why, but they've extended it out to August 30th, which will make for some complicated things for any appeals if that becomes necessary, because an appeal takes about 60 days and the implementation has to be October 1st. And you have to hire staff and you have to, there's all kinds of things that have to be done in order to do that. And in our contract, or our application, we would be contracting with Wapello County Public Health and Jefferson County Public Health to provide those services. And so there's a lot of things to get done if we do happen to be awarded child health. If we do not get awarded child health, I'll probably want to come back and tell you exactly what that means for
Right.
us. Because that's a big deal. That's a huge deal. Okay, functions required by Board of Health by code. Mark asked me to bring this or to outline this. And so you'll see that these are in that 17-page document. These are the things that they say, the Board of Health shall. So this is the shall. Required immunizations when otherwise not available. Communicable disease follow-up, isolation and quarantine, immunization audits, dental audits, community health needs assessment, law enforcement or a Board of Health shall impound a dog running at large and not wearing rabies tags, dog bites, impoundment, confinement, rabies testing, and regulate private water supply and private sewage disposal. That is all that is absolutely required. Everything else is you can. That's not much.
Mm-mm.
No. Okay, next slide. Services to individuals are not required of the Board of Health. And the state is moving local public health to population-based services. They changed Chapter 80 and eliminated the grant dollars for direct services and moved them all over to population-based services. So what that means for us locally, and this is not a region-wide, this is a county by county. So we have our own contract with IDPH that is just for Marion County for Chapter 80. So homemaker services, we'll be phasing those out this year. We're not taking new clients. Nursing visits to homes for setting up meds or whatever, that will no longer be allowed under Chapter 80. Foot clinics, we already moved that to fee for service instead of a suggested donation and covering it with grant dollars. Indigent home care, we, like if there was somebody who was uninsured and not Medicare age and they, for some reason they couldn't get insurance, then, and let's say they had a car accident and it wasn't covered under their auto insurance or the person's auto insurance, then we would pay for nursing care in the home for, X number times a week times a few, weeks until they could get back up and
Right.
running again.
Kim, as a result of all, little aside, but what's our relationship with Medicaid and Medicare as a result of all this? How will it change it?
If we do not get awarded child health as things stand right now, we will lose our ability to bill Medicaid for anything except for immunizations. And we have an immunization grant that covers immunizations. And we would be able to bill for Medicaid immunizations, but that's the only service that's allowed now under local public health, NPI, and taxonomy.
Hmm.
So unless they change that, it's not good. We wouldn't be able to do a lot of those things like, we have people come in and they don't have any insurance and they're eligible, so we do a presumptive and they
Right.
can go to the doctor right then.
Right.
And we won't be able to do that.
So
So,
all those synergies we wanted to create between our different social service outlets
yes. Yeah,
would be gone.
the days of you don't know what to do, go to public health and they'll figure it out for you.
Those are about done.
Those aren't, they're not going to be paid for by Medicaid or anybody else. So that's something that would have to become a local expense. So I think that the boards will need to talk about what is local public health going to look like
Mhm.
if this actually unfolds this way. And I think we need to be having those conversations. So, the table of organization did talk about screenings and such, so, but they're not going to pay for them. So, no blood pressure screenings, blood sugar screenings, cancer screenings, all of those kinds of screenings that we do are not eligible to be paid for with the state grant dollars anymore. So worst case scenario budget swing. From getting all of the services we applied for, which we already know that we're not, to not getting any is a swing of $2.6 million and change. The expenses will decrease, like we didn't get WIC. We're not going to provide WIC. Those WIC expenses will be going away as a result of that. So the staffing and all of that will go away. If we have no child health award, we will lose access to billing Medicaid, and we'll talk more about that if that happens. And we should know that at the end of the month. So, okay. So pretty bad news, I
Steve?
think, overall.
Well, yeah, I'm looking at all this and they're telling us they're not gonna pay for this, and not gonna pay for that, and if we're looking at a new look for public health in Marion County, what's the advantage of being in this collaborative service area? Why don't we just take
Because
care of
it's-
Marion County?
Because it's mandatory. Because they
Really?
That-
I know,
they
but
just
you get my point.
redesigned it. They just redesigned it.
Well, if we have to take care of ourselves,
How ironic that it's a collaborative service area when the other provider refuses to work with you.
if we
You don't want your, you
if
don't want
if-
your space.
if we have to take care of ourselves, to heck with them. Let's take care of ourselves.
Well,
I-
and that would kind of be what happens is that we'll take care of Marion County. We wouldn't, if we're not awarded any of that stuff, our responsibility is Marion County and that's it.
Well, that kind of looks,
Except for,
it
preparedness.
feels to me, Kim, like that's what they're forcing us into.
yeah, except for preparedness, we still have some pretty big contracts for preparedness. We still do the public health emergency preparedness and the hospital preparedness grants. And we still have that Southern Iowa grant, but that is temporary money.
Mhm.
So
So,
carving out so let's set preparedness on the side. That's a
Yeah.
little different. It's a little different animal here.
yeah,
But what we are really talking about, Steve, to your point,
Yeah.
is a restructuring of public health to satisfy the needs of Marion County residents
Right.
only, except for the programs that she's outlining,
Right.
because we just don't have the funds
We-
to do those
we-
types of programs. That would
No.
be,
well, we don't have the funds, we don't have the structure. I mean,
Yeah.
that belongs to somebody else now.
Yeah.
Yeah, and so it will be their responsibility to serve Marion County.
so we have to go through at some point, depending on what happens with child.
Right.
And I think it's appropriate to see where that goes on the 30th.
Mhm.
But if it goes the same way as everything else, the next step is, what does public health look like?
Right,
Yeah,
Post
right.
I find it very frustrating that Marion County Public Health has had these programs and served them well for so many years. Why do you want to fix something that's not broke?
Well, and your point is exactly right, Steve. And Marion County Public Health, from previous boards of supervisors, even before I was on the board, was built specifically to to be a regional public health.
Right. Our
To-
building was built with that in mind.
Yeah,
That was the whole intent. And for 20 years, we've done that.
and it's worked well.
And it has worked well, extremely well. And now they want to rip that apart and change all that for whatever the reasons are. But with little or no local input. And that's
Yeah,
the thing you've
nobody
got to
asked
remember.
me.
This is not from, they've not asked us, they've not asked anybody else. This is done at the state level,
Right.
saying we know what's best for all of you in this
Yeah.
regard. And that's not a good thing
No. And
at
we-
all.
We did have letters from every public health in the new service area. We met with them, we talked with, how can we work together on this so that we can build local public health infrastructure and help kind of stand you guys up too. And so all of our applications were built around working with and contracting with the local public healths in the service area. And because in the very beginning of all of this, IDPH and Director Garcia was like, we're going to build public health. Okay, all right. I didn't know that she meant we're going to build the state differently. And my personal opinion, this is opinion, is that there are so many state staff that have literally never met anybody that needs service, that they just are building this thing and not understanding the consequences of it. Because they don't know how it really works at the local level, because they've never been at the local level.
Right.
They have people making rules up there who are, they came out of college and they went and got their MPH and they did their internship at the state health department and they stayed. And they've got no local experience, so they don't really understand that what they do over here affects this over here. So they're making decisions, and then the upper management is making decisions, and she's new to Iowa and doesn't know how it works either, so.
Yeah.
But it's what it is. And we'll just have to figure out, what does Marion County Public Health look like at the end of this?
Right.
Kim, I got a question for you so that I can better understand. When the 23 original regions like this map,
Yep.
I mean, what we, as a county, we're handling this region. Awarded, is that typical? Was it awarded to counties or was it awarded to nonprofits prior to those other
It was,
22?
it was kind of a mix.
Okay.
There was us, there was Lee County Public Health, Washington County Public Health, Webster County Public Health, the Health Department in Woodbury County, Siouxland. So it's kind of a mix, and in the end of this, Taylor County Public Health. There's Webster County didn't have any competition. So Webster County they're fine.
Okay.
Siouxland didn't have any competition. So it really depends on
There was,
where they built those boundaries and who they put you in competition with. So
So do
this
you-
was a decision.
so
this
what
was-
did
this was a
Lee and
decision up there.
Washington and Taylor, you think, did they lose out too?
Well, their situation's a little bit different because Taylor got put in with Matura and they were willing to work together.
I don't
And
know what that is.
so
Okay.
they're working together, and Matura has WIC, and I think they agreed that Taylor would have maternal and child health, and then they'll subcontract with one another. That wasn't an option in our area. So, and that's kind of how the whole Lee County, that over in that southeast part, well, Lee and Washington are working together, and yeah, so there is some working together there so that their staff doesn't all get shown the door.
Right. So I'm going to just say this just so we can get it on the record. But you have taxpayer money and the state is making arbitrary decisions as to how that money will be distributed. It is not consistent or uniform across any county or any region. It just depends. It's all circumstantial. It's the same thing we went through with mental health. We picked a 3-county contiguous region, and when we asked them why, they said, well, 3 sounded good. There was no data. There was no statistical evidence that 3 counties made a good region. And then they disapproved all the 3-county regions, except for the largest. So the thing that the taxpayer needs to understand is you have a state government apparatus that arbitrarily makes decisions about your tax money that impacts you, and they really don't have a coherent rationale as to why they do it. Because to Kim's point, they have a bunch of lower level staffers that have never been in your county. They don't know what goes on. And they're making decisions about that money and where it goes and how it should be utilized. And that's not right. Period. All right, Kim,
So-
what's left?
So what's left is we wait for the child health decision. I won't be surprised either way. It did require a lot of letters of commitment, which we have. I don't know what their application looks like yet. I'll ask for their application after the award, regardless of how it comes out. And then we will be able to appeal if we are not awarded. And we'll just have to wait and see what that looks like. And then we do still have, substantial contracts with preparedness. But some of that is very temporary money. You'll see on that handout with the financials.
Right.
Okay, so, and this is, I'm sorry, I sent you the wrong one. So this is the right one.
Yeah.
Okay, so if we have all of it, it's in that first yellow column.
Yeah.
Without WIC, that's the second yellow column. If we don't have maternal and child health and WIC, that's the blue column. And if we get none of the competitive stuff, that's the pink column. And then I probably should add another column that takes out the temporary money from COVID for emergency preparedness, because out of that 3.7 million, 2.7, almost 2.8 million is temporary money from COVID
Right.
that should end in June, but they'll probably take it over another year, because I can't imagine that we'll get it all spent.
Right.
So we'll see how that comes out. But that is temporary money, and that's another really important thing for you to keep in mind. Because when you take that money out, and it's slim pickings.
Yeah, there's not much left after
Yeah,
that.
it's way slim pickings.
So Kim, what I would like to do, and I appreciate this update. This is good. We have a lot to digest.
Yeah.
After the 30th, we'll know,
Right,
we'll have with or without
Yeah.
child health.
right.
Probably the meeting after, which I don't know what date that would be,
September 13th,
September
or
3rd.
unless you're talking about Board of Health. I'm not
No,
sure.
I'm talking about this one.
The next board meeting will be September 13th.
Okay. So that meeting, this has to now be a regular discussion about how this is going to be structured
Right.
post that award
Mhm.
with preparedness. What does that look like? And to be honest, I think we need to start drilling down, and maybe we need some recommendations. I don't know if you and Jeff or whoever can get together and say, this is what we think this should look like, and here's some options for the board to consider. Instead of us going through lines and items
right.
and trying to sort all this out. It would be, we think for the best interests of the citizens of Marion County, here are some recommendations. We can certainly alter those
Mhm.
by
Yeah.
asking questions for the next month,
Yeah,
which I encourage the board to do that. But that would be very helpful, I think.
Yeah.
To,
Yep.
to get down to where we should be, what the funding will look like. Jake, from a budgetary standpoint, impacts relative to that. It's really just not getting the cash we thought we were going to have right now, but staffing certainly will be a major impact.
it'll be huge.
Lisa, that's going to have an impact on our benefit program. Where do we go in terms of our large group status? So there will be a domino effect
Mhm.
that will flow through several different things that we will have to consider. So.
Yeah.
Okay,
So-
does that make sense?
Yep.
And Kim,
Or do you have any
Can't say I
questions right
love
now
it.
for
yeah,
Kim?
I just was thinking, Kim, could you send us as a board, an email on regarding when you find out on
Oh,
child health?
Absolutely.
And then, yeah, I appreciate that. And
Yeah,
I will reiterate what Mark said. Yeah, it's just ultimately what this is going to, the bottom dollar, what this is going to look at.
oh, yeah,
And
I-
impact on the budget.
I know. There are a lot of public healths in Iowa that have 1 to 5 employees.
Right.
We've had just under 40 for a lot of years.
And I'm glad you brought that up, Kim, because I do want to say this, no matter how this ends up looking. I think for the last 20 years, the Board of Health or the Public Health Department of Marion County has done an outstanding job. And I can just look back to COVID as a prime example of the work that the folks there did, going above and beyond the call of duty. So no matter how this shakes out, it's not being driven by the citizens of Marion County. It's not being driven by the board wanting to make these kinds of material alterations. And it certainly doesn't diminish their work that
And
those folks did.
The staff is frustrated and they're afraid. I'm just gonna,
I,
and
can
people
understand
are
that.
starting to leave, and when they come to me and they say, I have to go, you know what, I totally get it, and go, if you can make your family safe, do it.
Kim, is there a way, I'm going to make an assumption that we don't get that. If that happens, or even if we do get it, but we don't have WIC and we don't have these other things, how do we monitor this so that we can tell legislators, pay more attention to what's going on in this county? I'm sorry, I'm ticked right now because I don't care that they tell me, yeah, we know they don't know what's happening.
They don't get it.
And there's no pushback from a legislative standpoint. And if there is, nobody tells us because they don't come to these meetings. They just,
Well,
we're
And
we're
I-
not that important
I
for them.
emailed our two new ones and haven't heard anything back.
Right. They don't. And you as taxpayers and you as voters need to remind these people they represent you at the state level. We don't. We try to stay on top of this from a local level and remind them of some of the things that are happening to us. But that's their job. That's why they ran. And this is a material change to the services that Marion County once provided and provided for 2 decades. What else is going to change?
Well, and,
Mental health has already changed.
oh, yeah.
Now it's public health. What's next? Going to consolidate all the treasurer's offices?
Well, and
Start
then-
doing that?
Well, and you start looking at, okay, because I've already started looking at, okay, if we can't serve this way, and we just, how can we serve Marion County better? And finding a way to fund that. And I was thinking through mental health in chapter 24, and I talked with Rachel Cecil, and because we're governmental, we can't serve under chapter 24.
Right.
Because you have to be a private nonprofit.
You have to be a private nonprofit to do that.
Yeah.
I mean, at a minimum, Kim, I'm speaking for the record more than anything else. Wouldn't it be a novel way if you're going to reform government, like the state seems to want to reform government, that somebody from that government would come to a meeting and describe for the citizens and the board the benefits of the change?
Mhm. Yeah. I had a public health director get with me this last week, and she said, I just wish that Director Garcia would give us the end game so we know how to get there.
They don't know.
Just tell us what you're doing.
Yeah, they don't know.
And yeah,
And I do think with these new legislators, we need to find out what, before, like Amy Sinclair was education, John was public safety. We need to find out what their focus is, because at the state level and when dealing with them, and I'm sure you guys know that, they all have their specialty. So who is doing public
Sure.
health and
Yeah.
is on that
That's-
focus?
That's true, Keisha, but they're not elected to be specialists. They're elected to represent all of us on all issues. And I know they get pigeonholed into these things, and then that
that's
becomes a
the-
convenient excuse to say, well, I'm the education person. No, you're not just the education person. You're representing all of Marion County on every single issue that's brought before the state, period.
Yeah, it's the committees that they're appointed.
Mhm.
Yeah.
And you can't use that as a dodge to say, well, I'm not involved in that. So anyway,
Yeah,
as you can
sounds-
tell, I'm a little hacked off.
yeah.
Kim,
that feeling's
all right,
pretty
we know what we're
universal.
doing next. Is there anything else that you want to add
I think it's
before I
enough for
really
one
start
day.
ranting?
What's that?
Before I really start ranting?
No, I think this is enough for one day.
All right.
Thank you,
right.
Kim.
Thanks.
All right. Is there a
Thank you.
motion to
Kim.
close discussion on this item?
Make motion to close discussion.
Second.
Johnner,
Aye.
McCombs,
Aye.
Ramey.
Aye. Very good. Thank you. And we will, Jake, if you remind me, keep that on the list of items. Updates, Mr. McCombs.
Well, I have a meeting, a tentative meeting Thursday.
I have public health, or not public impact, sorry. We just talked about public health.
That's all right. It's on our mind.
Impact was supposed to be this Thursday. They've canceled, but it's my understanding that now Impact is in Marion County and at the public library on Mondays. I don't know the dates. Is that's already started, correct, Kim? That wasn't? Yeah. So I'm assuming that those like Kim and others are funneling them that direction. I do think it is important that they have presence in Marion County. The only other question I did have for the board is my understanding is Director Durham coming next week, is that? And how is that working? Do we
Well,
know?
that's,
or is-
that's in my update. So
Okay.
I'll do that.
All right.
All right. Anything else?
Nope.
All right, very good. So several things going on. Had a meeting yesterday, our monthly meeting with Knoxville for the VA update. Talked about mowing and keeping the property neat. And we've got mowing agreements already in place, and Chris will coordinate that with the city. And we're also thinking about maybe expanding. We have a contract right now for paying out the western portion of that. And maybe we expand that contract to cover the rest of the VA. So they're looking into that. Jake, they'll be talking to you about what the process would be to maybe expand that hanging contract, if that's something the board would want to do, just to keep it down
Mhm.
before we do any construction. The second thing is we'll be having a meeting between the schools, myself, and the city to really talk about the next step of, we've got our confluence plan. So now what's the next, what are the next details that we want to discuss to bring that plan to life? We know that's a long-term plan. Nobody should look at that plan and say, well, that's going to happen in a year, because it's not going to happen in a year. We're talking about a generational plan. But we've had some good preliminary discussions on that, and we'll have a meeting on the 29th. I think Renee's already set that up for my schedule. And then we have Deb Durham here on the 31st. Carla, I don't know if there's anything you want to add to that before I talk. I don't want to steal anybody's thunder.
No, we'll be going to kind of looking over two sites, first here in Knoxville, talking about the VA. So we'll have a discussion first and then go out and allow her to see the site where it's at currently. Then we'll be going to Pleasantville, talking about a couple different things in Pleasantville, both the commercial industrial Atkins property that was approved here a couple meetings ago, in addition to a couple housing projects they have going on, as well as Smoky Rose expansion. And then we'll be touring a couple of the sites there.
Very good. Thanks. Thank you, Carla. And then our focus with Deb also is to talk about the RIF money and beginning that application process. Brian Hatch and myself will present again an overview of the confluence plan, where we think we are at with our other interested parties, and try to give Deb a good overview.
Yeah, and in
of where that stands.
addition to Director Durham, she will be bringing her staff person that oversees that program,
Good.
as well as one of her economic development folks that would be more applicable to the laundry building and the redevelopment of an actual building that's there right now. So
Excellent.
there'll be two other staff persons with her, as well as her
Good.
admin person.
Excellent. That'll be good. Good discussion. And then sometime in that mix, I'll be meeting with Joe Merstick over in Pleasantville to fire up the financial component of that discussion. So I think that is this week, if I remember right. I'm putting Renee on the spot, but I'm pretty sure it's this week. And then I'll be out of state from the 8th through the 21st, visiting my children in Cincinnati and Pittsburgh and the Gettysburg battlefield
In September.
in September. So Jake, I'll be doing the 13th meeting remotely, maybe.
Yep.
Depends on
Well,
where I'm at.
Okay. As
All
long
right.
as we have, well, the remote works really well. So we have two. at
Just so
least.
so you both have to show up.
So we have an election
So-
that day as well. So it's going to be an interesting day. And then
Alright.
we'll, a week later, we'll also need a canvas. So we'll
Yeah.
have a quick special canvas.
Okay,
That can be done remotely as
good, excellent. Well, that's all I have. And is there a motion to adjourn?
I got a question though, real quick.
Oh, yeah.
And regarding the visit with Director Durham, is there any way that we could have, I mean, if it's meeting here, can we have a meeting so that we can all be present, or?
I was going to kind of ask, is that just I wasn't sure if that, what was.
Not
needed.
really. It's really not a meeting for that.
It actually, I think, in talking with Glenn, I think it will actually be at the
It's going to
Knoxville
be,
Public
it's gonna be at the
Library. So
Public library and
Okay, so it's not a board.
no, it's not public meeting.
Thank you for that clarification.
Good. Is there a motion to adjourn?
I make a motion, we adjourn.
A second.
McCombs,
Aye.
Ramey,
Aye.
Johnner.
Very good. Thank you.